If you are currently taking medication for allergies, insomnia, anxiety, depression, or even for bladder issues, you need to be cautious because some of these medications might be silently increasing your risk of developing dementia. In fact, research shows that taking one of these very common drugs every day for just 12 months may raise your dementia risk by up to 50%. Multiple large-scale studies have revealed strong evidence linking these medications to memory loss and even brain shrinkage. And we're not talking about rare or experimental drugs here. These are everyday medications, the kind you probably already have in your medicine cabinet. In this video, I'm going to explain what these medications are, how they quietly damage your brain, and I'll also share some safer alternatives you can consider instead. If you have family members who take any of these medications, please share this video with them. So many people are unknowingly harming their brains and speeding up the onset of dementia without realizing it. The medications we need to be concerned about belong to a group called anticholinergics. That's just a scientific term meaning they block a brain chemical known as acetylcholine. Acetylcholine is a crucial neurotransmitter. It's like the spark plug for your brain. It helps your neurons communicate with one another. You need acetylcholine to form memories, stay focused, and even to move your muscles properly. When you take anticholinergic drugs over long periods, it's like jamming the gears in your brain's communication system. The signals between brain cells become weaker and weaker, which leads to cognitive decline and eventually dementia. Now, here's the critical part. Anticholinergics are found in many common medications. For example, allergy medicines like Benadryl, certain anxiety medications like Hydroxyzine, also known as Vistaril or Atarax, over-the-counter sleep aids such as Tylenol PM or Unisom, bladder control drugs like Ditropan or Detrol, even motion sickness patches like the scopolamine patch, some IBS medications such as Bentyl. Some of these are available by prescription, while others can be bought over the counter, but they all share that same brain-blocking effect. Let's talk about the science behind this. One major study, a systematic review and meta-analysis involving over 1.5 million people, found that anticholinergic drugs are an independent risk factor for all-cause dementia and Alzheimer's disease. It also concluded that the higher your exposure to anticholinergics, the greater your risk of dementia. Another concerning meta-analysis of 21 studies showed that using anticholinergic of more than 3 months raised dementia risk by an average of 46% compared to those not using them.
That's nearly a 50% increase in risk after just 3 months of use.
There's more. One particular study published in JAMA Neurology used brain imaging and found that people taking anticholinergics had more brain atrophy and signs of brain dysfunction. This isn't just about feeling a little groggy. These medications literally change the structure and metabolism of your brain. So let's take a deeper look at what's happening. In your brain, acetylcholine binds to muscarinic receptors on neurons. This is what allows brain cells to communicate. These receptors are part of the parasympathetic nervous system and are found not just in your brain but also in your heart, lungs, and digestive system. That's why these drugs can help reduce nausea, muscle spasms, or control an overactive bladder. But in the brain, these medications block communication in areas such as the hippocampus and the cerebral cortex, regions essential for memory and cognition. Short-term, this may cause brain fog, confusion, and slow reaction times. But long-term use leads to permanent damage and brain shrinkage, especially in older adults, whose natural acetylcholine levels are already declining with age. So if you're taking a drug that further suppresses this neurotransmitter, you're just accelerating that decline. Over time, you're effectively cutting off one of your brain's main communication lines, and the longer this continues, the more harm it does. So what should you do about it? Now, I'm not saying these medications should never be used. For example, taking a Benadryl for a night or two to help with sleep isn't ideal, but it's probably okay. Sometimes these drugs are necessary for managing severe allergies, urinary incontinence, or irritable bowel syndrome. But what you want to avoid is daily, long-term use over months or years, especially if you're in a higher risk group. That includes people over 60, anyone with existing memory problems, or those taking multiple anticholinergic drugs at the same time. And this happens more often than you'd think. In my practice, I often see patients taking Hydroxyzine for anxiety, Benadryl or Unisom for sleep, and Ditropan for bladder control. Each of these on its own blocks a little acetylcholine, but together they can shut down major brain functions. So here's what you should do. Do not stop any medication without consulting your doctor first. Always discuss with your physician whether you can switch to a safer alternative, especially if you need long-term treatment. Check your medications, prescription and over-the-counter. Look them up or ask your doctor or pharmacist if they are anticholinergic. Here are a few examples of safer alternatives. For sleep, consider melatonin, ashwagandha, chamomile, or magnesium, but make sure you're using the right form of magnesium. I've made a separate video on that, and I'll link it below. For allergies, use second-generation antihistamines like Zyrtec, Claritin, or Allegra instead of Benadryl. These don't cross into the brain as easily and have lower anticholinergic effects. Presmation-wise, trazodone is often a better option for sleep because it has minimal to no anticholinergic effects. For IBS, if you're taking Bentyl, talk to your doctor about options like peppermint oil or other prescriptions, depending on whether your IBS is constipation or diarrhea permanent. For bladder control, if you're using Oxybutynin, Ditropan, Detrol, or Vesicare, ask your doctor about switching to Myrbetriq, a non-anticholinergic alternative. And if you've already been on these medications for a long time, don't panic. You can still take steps to protect your brain starting now. Focus on improving sleep, staying physically active, and addressing other dementia risk factors like insulin resistance, high blood pressure, or heart disease. I'm also working on a full video series about how to optimize your brain health, and I'll be diving deeper into that soon, so stay tuned. Please like, share, and subscribe to our channel. Thanks for watching.